David, as he mentioned yesterday, started his medical career as a doctor here at Cedars-Sinai many, many years ago. We almost overlapped, and I believe he went into infectious disease, ID, and he had a career in health technology, as he discussed briefly yesterday on the panel, particularly around electronic health records and clinical decision support and some of the early phases of trying to understand how to use the computer to improve the patient-doctor relationship and improve outcomes of care. And with that background, he went to Samsung, where I think for the last 6 years he's had this role as Chief Medical Officer. And what's really great about David is he has a background in health services research, in science and methodology, and he brings that to everything that he touches. And that's been our experience working with him in a partnership role to develop new trials and new studies. And although we all want everything to be positive, we also have to understand if it's negative and learn from that. And it's great to work with a company and with an individual who gets that and is about the science and about the evidence and about doing the right thing. So he gave a talk last year with the same title, On the Cutting Edge of Therapeutic VR, and now it's on the cutting edge of therapeutic XR, because I think VR is starting to become passé. So come on up, David. Thank you for being with us today. We really look forward to your newest comments. Thank you.
Great. Thank you so much, Brandon. It is, again, a real pleasure to be here. As most of you are well aware, Samsung is a very large consumer technology company, but we also have a very strong interest in understanding how that technology can be used to improve health outcomes. How can we improve access to care, quality of care? How can we improve the patient experience, the clinical experience for doctors, nurses, pharmacists? And can we take cost out of the equation? And with all of these, we've been looking at technologies, everything from phones, tablets, wearables, to now newer immersive technologies such as virtual reality, augmented reality, and even mixed reality. So before I jump into that, I want to start off with a story. So I have 2 young kids. I have a daughter, her name's Amelie, she's age 10. I have a son, Nathaniel, he's age 8. And this is a great age, the 8 to 10 year range. They are able to see the world, they're optimistic, they're fun, they're excited about everything, and they ask some really probing questions, things that oftentimes I initially kind of think, well, that was just kind of a silly question, but then I think later on, wow, that was a really good question. And a few months ago, my son, Nathaniel, asked me the question, if you could have any superpower, what would that be? And I thought, boy, I hadn't even thought about that. What would you do? And he said, almost without hesitation, oh, I'd love to be able to teleport. And so rather than flying or being able to, lift buildings or cars and be able to spin webs out of your wrists, you'd want to teleport? And he goes, oh yeah, I would want to be able to wake up late and be able to go to school and just like that, teleport. I'd want to go to Disneyland and New York and all these fun places and just go there. And I thought to myself, that's kind of interesting. And I didn't really kind of realize the benefit of that until I was actually on the road, stuck in traffic in the airport. I thought, that's actually a pretty good idea. But what I realized is that really is the genesis and foundation of what VR is. You're teleporting yourself to another world, another place. And while kids may think it's fun, in many ways, that immersive experience is something that we're seeing again and again. This concept of these technologies being used for fun as a way to engage people. And it started out when you think of everything from virtual reality to augmented reality with Pokemon Go, and to some of the earlier games with HoloLens, and now some of the more immersive technologies for training. It's immersive, it's interesting, it's fun, and that's what gets people excited about it. But at the same time, we're recognizing that these technologies can be used to treat patients, to help better understand how these diseases are working and how to train for procedures. And so a couple of examples, or a few examples, in terms of mixed reality, being able to have an organ come out and be able to dissect that virtually, to be able to use a device that can help you with the identification of where to put the IV. And I sure could have used that when I was an intern at the VA. Very difficult, but now you can see the IVs and help facilitate that. And then there's a solution that we actually work with a partner called Scandit, where they have now built in onto the Epic Rover system an ability for pharmacists and other folks to be able to move the scanner over medications, and then it'll pop up information about the medications, and you can do barcode scanning and a variety of others. And now imagine a patient someday being able to have that same type of information. They get a bottle, move over, and see the information in their own language. This is the type of stuff that we're seeing again and again that is becoming really exciting, because it allows us to understand that these technologies can be used for not just fun, but also for some great use cases in healthcare. But very interesting quote that a year ago Brennan shared in a post that was that while it's not all fun, I mean, we can see good, but technology can potentially be used for evil. And I think the example Brennan used was standing on the edge of a platform and being able to leap off. Well, Brennan's right. So if you remember in Terminator, the concept of having the ability to identify things for targeting certain things, it could certainly be used for evil. But if you also remember in Terminator 2, 3, and 4, Arnold Schwarzenegger became the good guy. So it turned from good to evil very quickly, and he also became our governor. So we've learned a lot that it can be used for good and evil. But what I want to talk about is the good. In fact, the really good, the incredibly good that can be seen with VR and some of these immersive technologies. So I'm going to show you a quick video that's going to give you some insight into some of the things that we thought were impossible with current medical technologies and current treatments. But with immersive technologies, we now realize what's possible.
A star Paralympian who lost most of her vision as a teenager has been granted the gift of sight thanks to an incredible piece of technology. Jess Gallagher received a life-changing virtual reality headset.
Today, she was given a priceless gift, the ability to see clearly again after losing most of her vision at age 17.
I don't have the ability to see facial expressions, what somebody's wearing, and right now I can see everything. It's pretty amazing.
The virtual reality headset will help her outlook go from this to this.
Jester is this kind of exceptional guy. He was a teacher for 39 years. He won all these awards. He's a volunteer fireman. He is always helping people.
Last August, while I was working at a man's house, I fell from the chimney. I broke 19 bones. I had several rods put in my back and 16 bolts. And when I woke up, found myself with no use of my legs and no control of anything below my waist. And that's where this adventure began. I didn't think a human could experience that much pain. I started to put together things that I can use to try to alleviate some of the pain, but at the same time not depend on the chemical meds as much. One of the weapons in my arsenal is the applied VR virtual reality. If I'm having real serious pains and I feel like I want to take another oxy, a lot of times I'll strap it on. I can refocus my attention to flying on the Wright's airplane, or looking at animals out on the plains, or looking at farm animals. It would take my attention away from the pain, but I learned in my mind how to do that same thing for an hour or two after I used it. I have no intention of staying in this wheelchair. And some of the doctors say I'm never going to walk. I'm just telling you, okay, you personally. Okay, I'm going to walk out of Peconic Landing someday. The future of virtual reality in healthcare is probably limitless.
So one of the things that we've recognized is that each of these is doing something that's quite unusual. It's leveraging a part of our brain or our body that we didn't realize that we had the capability to control, and it's allowing us to be able to basically gain control of that. And whether it's virtual reality and stopping pain signals through some immersion process, We're seeing clinical results in trials that we've just heard about and we've heard over the past year of reductions in pain, decrease in anxiety. But these are tools. These don't represent by themselves the overall solution. And there's many ways that they can be used. And so, in fact, when we've looked at pain management, we've seen that it's not just about the immersion, but it's about also finding ways that you can use training mechanisms where, through something called VR amplification, you can help people that have weakness in arms and limbs move them by putting themselves into this virtual environment. And so these are data that come from one of our partners, Karuna Labs, where they showed that individuals were able to increase range of motion and essentially also decrease their sense of helplessness around this. And one interesting study that just came out, a very small study, 24 patients, a double-blind crossover study, where they looked at not just simply the immersion, but they looked specifically at the synchronization between the immersion and your own physiologic parameters. In this case, it was heartbeat. And they wanted to understand, does that ability to see things in synchrony with your own body actually help decrease complex regional pain syndrome? And this is a very similar concept to what we talk about synchronizing with breathing or synchronizing with heartbeats. And they saw a statistically significant reduction in pain just by simply focusing on how it was synchronized versus asynchronized. So what we recognize is that there's a lot more than just simply the VR headset and the immersion. There are a lot of different ways that these tools can be used. And we learned that the key is, how do we construct a process, a program that will solve some of these problems by using these tools in ways that are most effective. And the example that I'll share with you is one that we have currently as an ongoing challenge in the United States and perhaps globally, and it surrounds the opioid epidemic. So as we've talked to organizations across the country, including the American Hospital Association, and talked to organizations that are implementing tools like Cedars-Sinai, we've recognized that to be able to implement a program that will address the bigger topic of opioid addiction, it goes beyond simply providing a headset. And so we started thinking about what we call combinations of digital therapies that can be used in synchrony to allow us to be able to understand how to implement this. And a good example would be the work that we started with Cedars, Travelers Insurance, and Bayer, where we implemented what we'll call a digital pain kit. And as part of that, we looked at ways that we could implement the VR in conjunction with the breathing. So there was an element to capture the breathing that again, ties into some of the research I talked about, with a wearable that allowed us to be able to then potentially measure biometrics, which is a really interesting idea, because now we're starting to think that it's not just about the immersion and treating the activity, but how do we actually know it's working? How can you assess this in a quantifiable, objective way? And then potentially even use that for biofeedback. And then some physical tools, such as, in this case, a TENS unit to provide some electrical stimulation. And so this is an ongoing study, but it represents the type of model that we're thinking about, where we combine different tools in combination with other therapies to be able to improve care. And as part of the strategy that we've been thinking about to essentially battle the opioid epidemic, we've been thinking about it in terms of two contexts. Can you prevent doctors, or I should say clinicians in general, from wanting to have that urge to prescribe the opiate in the first place? But in order to do that, it's not just about the doctor clinical decision support, it's about having a program in place that educates the patient of the potential opportunities and alternatives, creating a pathway or a process so that the doctors and other clinicians can actually implement this. And it's not just about ordering it again, but it's having the team available that can provide the necessary support. And what we've also found is that in order for these types of programs to be successful, you do need what we'll, and Brennan and others have referred to as a virtualist. You need somebody who is an expert in terms of how technology can be implemented in your organization for healthcare purposes. And then you need to think about how this is going to be used outside of the hospital, because they may have had sustained pain relief in the hospital, but very quickly you're going to get a phone call 24, 48 hours later saying that I'm in pain. You didn't give me anything, so now what am I supposed to do? And they'll prescribe a narcotic. So what we wanted to do is we wanted to think a comprehensive approach. And in order to do that, it's a lot more than just the technology. And then when we started thinking about in the ambulatory setting, in the patients that are actually struggling today, the people that are already on these narcotics, what is it that we can do to really help support them? And in some cases, it was about trying to reinforce mindfulness techniques. Other ways, it was trying to identify the triggers for where they were actually having these attacks and figure out ways that we can take in programs that work through counselors, buddy systems, support networks that we've seen again and again work for other conditions, such as alcoholism, for drug abuse, and other types of things, and virtualize that. Make it 24/7 available to the people who need it. So this ability to virtualize addiction medicine support programs needs to be a part of the overall program if you're thinking about how you're going to manage things on an ambulatory basis. So I want to share with you some data that we've seen in the area of addiction medicine, looking specifically at tools that can be used to help support individuals. And so this was done in the context of alcoholics who were admitted 4 times in the past year for alcohol-related issues. And what we found is that this is a group for whom they have tried many support mechanisms. They have support teams working with them. They're really struggling, and they need some additional support. So what they did is they virtualized the program, in this case on an app. But they leveraged elements on the smartphone to be able to identify if you were near what we call trigger points. So these patients had identified that if I go to this bar, or I go to this drugstore, I go to this park, these are the places that I gain access to my drugs, my alcohol. I tend to have moments of weakness in those periods. So what happens is when you enter those spaces, you get an alert. Your buddy gets an alert. You have a panic button that you can hit that immediately alerts your friend, and they can basically respond back and support you in this. You'll get an automated support message. And the message isn't simply don't go there, but it's about reinforcing the commitment that you've made to stay sober, to stay away from these. And people are more likely to want to respond to the fact that they have already made a commitment, they want to stay true to that, as opposed to telling somebody to do something that they don't really have an interest in. So there is an element here of trying to find ways that we can improve that ability for people to have support 24/7 using these digital tools. And in this study, it was a randomized control study performed by the researchers at University of Wisconsin. They saw a 31% decrease in relapses. The severity of relapses were decreased by about a half. They saw decreased readmissions, total cost of care, and more of them were likely to complete the program. And this, in combination with other types of digital programs, is how we're starting to now think about how VR and other immersive technologies can be used as one of multiple tools that are designed specifically around conditions that we have now shown that validated independently, but now we're looking to see if we can validate them in conjunction. And with respect to virtual reality, now that what you saw in the video was remarkable. I don't remember if you recall, there was a person who was in an exoskeleton, he was kicking the ball. That was at the World Cup. This was an individual who had been paralyzed. Many of these individuals were paralyzed for as many as 13 years. They had not had any function of their bowel and bladder as well. And through the use of immersive VR technology with the exoskeleton, they were able to regain function. And this was a study that was published in Nature in 2016. And it has gained a lot of attention because it started us thinking in terms of what can this technology do, and are there other ways that we can battle the challenges of spinal cord injury. Now, what we had seen in that prior study was partial spinal cord injury. But most recently, this past year, there was an incredible breakthrough for patients with complete spinal cord injury, in which they found that the use of an implantable, it was actually a Medtronic implantable that we were involved because the controller is now a Samsung device. But that controller, in patients who had complete spinal cord injury, were paralyzed for the past 2 years or so, 2 to 3 on average, they were given this ability to basically regain function. And some of them regained function in less than a year, which is remarkable because now we're starting to realize that we've got some amazing tools that we can use in combination. And then most recently, if you were able to attend CES, Samsung demonstrated one of our latest innovations, it's an exoskeleton, but it's an extraordinarily lightweight, easier to manage, potentially an ambulatory device that could be used for patients with injury, stroke, spinal cord. And we are now currently working with the Christopher Rhew Foundation and a leading healthcare organization on the East Coast to implement these type of technologies to figure out how the combination of these tools can be used for different subsets of patients with spinal cord injury as they move down the journey of complete to partial to complete full recovery. And this is what's really exciting, because we're starting to recognize that it's not just about one tool, but it's about the combination of newer innovations that put together specifically designed for individuals that will lead to the best outcomes. And we're learning more as we do it. There's another really interesting concept of using virtual reality to treat concussions. It's a very common thing that we see in sports. But it also is very common in other types of just general activities that you would never imagine. In fact, one of the most common activities that children are involved in that leads to concussions is cheerleading. In fact, cheerleading, you wouldn't necessarily think of that being one that causes concussions. Certainly, what happens when you have these concussions is that there is currently not a great way for us to quantify it and even treat it. So a lot of times, what used to happen, I was on a panel at HIMSS this past year with Jack Youngblood, who some of you may remember was a former NFL Hall of Famer from the Los Angeles Rams. And he would say that when you actually got knocked out and they brought you to the sideline, the trainer would come out and say, "How many fingers am I holding up?" And if you said 2, then you said, "Go back in there." I mean, it really was. And today, there's not a whole lot different, apart from maybe some more specific protocols of sitting it out for a down or 2 or a half. But what they realized is that there's a lot more that's going on in the brain that we're not capturing. Is there a way that we can somehow use technologies to be able to quantify what's going on in the brain, almost like vital signs for the brain? And so a company that's based out of Stanford called iSync, or SyncThink, their product is called iSync, has identified that eye tracking is a particularly important aspect of not only measuring the degree of concussion, but also anecdotally they have seen that if individuals continue to use this device, they have seen improvement in recovery time. And so if you look at this example, these are data that were shared to us. They currently use this at Stanford and all of Pac-10 schools for NCAA, as well as the Golden State Warriors use these type of devices for their players. This is stuff that right now we are starting to see being widely used in the athletic world, but it has direct relevance to us in the medical world as well, because we need to know what's going on and be a part of this process, because there's a lot of science behind it, and it's working. So if you look at the example on the left-hand side with a normal, that circle is eye tracking. So you're following a little dot that goes around in a circle, and you just continue to trace that. And so all those little lines are very smooth when you don't have any brain injury. When you have brain injury, you actually have occasional, we'll call deviations from that. And then you can see it continues to improve during recovery. And what we realized was that this also was a great tool, potentially not only for diagnostic, but also for treatment. But that's not the only thing they do. And so if you look at the current protocol at Stanford, it involves 4 things. It involves the visual orientation training, but it also involves cardiovascular and cardio exercise. It involves improving your sleep, making sure you get enough of it, and education. A lot of people are not aware of kind of what the extent and the recovery time and the statistics behind all of this. So these are the types of things that we're now recognizing are really important. If you want to implement this as a program to improve concussion management, it's not just about give the device, it's about all of these other aspects. And we're also seeing the VR being used in other ways. This is a company called Vivid Vision, or that's the application, I should say, and this is specifically to help improve lazy eye. So I'm not sure if you've ever seen the current treatment, it's a patch. People walk around with this patch and they try to improve it. Well, this one actually has been shown to be better than the patch. And it uses some games, and it uses the ability to track this. And there's a session that you have to do every day. But you can see that with these sessions, that they have some really interesting and very compelling data that suggests that your improvement in stereo acuity, the ability to see evenly, improves on average as you continue to go through this. So this is now becoming a new mechanism for us to think about conditions that we don't normally think about, lazy eye. But a big area of focus for us has also been around how this can be used in individuals who have a typical aversion to technology in general. And that group, in many cases, falls into the category of people who've never used tech, and they don't really have an interest in it. And traditionally, people have thought seniors would never use tech. But we're seeing that that's not necessarily the case. And in fact, all of us are aging. In fact, we'll soon, very soon be finding that we need to use some of these technologies to be able to better take care of ourselves. But at the same time, even the current seniors over the age of 85 and others that have never used tech before are starting to find some extreme benefits. Certainly, there's benefits from the context of pain, stress, and anxiety. But even the area of dementia, one of the areas that we have really not looked very extensively because there's not a whole lot of great treatments. Today, what we find is that if you want to address dementia care, the best way to do that is something called reminiscence therapy. So reminiscence therapy is essentially trying to ask the individual to remember or recall certain events in their lives. You'll show them a photo album, but periodically you show them a photo album and then the individual just kind of doesn't have any interest in it. So there's no more reminiscence therapy when they're not talking. So what they found is you put the VR headset on, they're now back in their own hometown, they're in their old home, they're back in Paris where they got engaged, they're all these places that they wanted to be, and they're talking about all this stuff, and that's when you engage. And that was one of the key lessons that many of these folks, these researchers and statisticians and other people that have been looking at this, it wasn't just about put it on and all of a sudden you've got them talking. That you start with the reminiscence therapy. It unlocked the opportunity for us to be able to continue. So even in that scenario, we found opportunities. Seniors oftentimes have issues, and we see this today in hospitals, sundowning. You can almost predict when an individual is going to get agitated, potentially even violent. It happens a little more frequently and more aggressively when an individual has dementia. So that's an area where they have been looking prophylactically to see whether or not you can use this to decrease that agitation. And we're seeing anecdotal evidence of all of that. But other things that we had not anticipated, could we use this to actually improve vision? Can we address loneliness? And so what we talked about, and you saw that in that video, this opportunity for us to be able to leverage a part of the body that we've never used before. And in the case of blindness, we oftentimes think of blindness as the fact that you've lost vision because your eye is completely damaged. But that's not necessarily the case. And a lot of times, what's happened is if you look at the eye, there's an area that is responsible for visual acuity called the macula. And the damage could be due to a condition that could be such as macular degeneration. It could be due to things such as diabetic retinopathy, and you name it. There's a whole list of conditions that affect it. But when you lose that visual acuity, it's pretty much difficult for people to kind of deal with it. What we don't realize is there's actually a secondary part of the eye. Every one of us has that's adjacent to it called the preferred retinal locus, the PRL. If only we could latch on and find that and magnify it, we'd be able to see again. And sure enough, that's exactly what was being used in that technology. The VR headset allows you to be able to latch onto it, magnify it, and restore vision. And in a study at Johns Hopkins, they saw that patients that came in with macular degeneration with a baseline vision of 2400 had it improved to 2030. So it's remarkable. It's being used by over 100 ophthalmology centers across the country. It's something that we need to make sure people who have conditions that decrease vision are aware of, because in many cases, they can have restored vision. And the company I'm talking about that actually did this is one that we've partnered with. What I really like about their solution, one, it's validated, but it's also the least expensive solution on the market. There are a couple of others that do this. This will cost you about $2,500. They live stream videos from Netflix, and so people who've never seen movies can now see this. It has voice assist. It's really been designed around improving the user experience for individuals that have never been able to, or for many years not been able to see. And one of the things that we're recognizing is that as we address these topics of decreased vision, hearing, improved functional status, that will allow us to be able to do something that we've never been able to do before, which is address the functional capabilities of individuals to live independently and address issues around concepts that in many ways seemed a bit far and difficult. In this study, it was around loneliness. One of the largest studies a Canadian longitudinal study on aging, where they looked at the independent risk factors for loneliness, and they found that hearing, vision, and in fact the combination of that was associated with loneliness. If we can address those, we can improve the functional status and potentially allow individuals to be able to regain a sense of connection and self-worth. And that's what's really exciting about all of this, because what we're starting to see is that these tools, that everything I've shared with you, is now something that we can now put together in terms of programs that are going to address the way that we address many of these conditions, but also rethink what's possible. Where in the past, what we used to think was the best way to reduce costs was to prevent people from coming in by calling them up and doing some care communication. What if we could reduce readmissions and prevent and increase health by improving the functional status of individuals so that they're able to better walk, better able to take care of themselves, better able to see, so that they have less pain, so they don't need to be able to be taking so many of these medications that cause problems. What we're finding is that a lot of these issues that we run into, falls and other types of issues, are because these people are spiraling. They're taking medications, they're getting dizzy, they're falling down. They're finding that they don't have an ability to take care of themselves, so they're lying in bed all the time, and they're ultimately getting bed sores and infections. If we can improve the functional status through technology, raise the tide, get these individuals to the point where we've given them comprehensive programs that will address these solutions, we will have improved healthcare for all. Thank you very much.